I'm going to be talking about Foley catheters and helping you to better understand what we use them for, what are the risks and precautions with Foley catheters, what should we be looking out for, how to insert them, how to put them in, that kind of stuff. So one of the things that I know, it's definitely helpful to hear about any topic, especially when it comes to nursing procedures. I know there are a lot of nurse graduates that are actually very nervous about even putting in a Foley in, or that just nervous in general about Foley catheters. So what I hope is after you watch this video, not only will you feel more comfortable with Foley catheters, but you'll have an understanding of them and why we use it and so forth. So one of the ways I wanted to do this in order to really help you not only retain it better, but grasp it better, but help you to really understand it well. And I have in front of me a Foley catheter. So this is not the entire Foley catheter kit. This is the drainage bag, but still I wanted to use this so that way you can really begin to see how they work and so forth. So first of all, foremost, so here's what we should be thinking about. What are some reasons why we would need to put a Foley catheter in? Right, so that should be something that you know and identify. So one of the reasons, reason number one, is because the patient is on strict intake and output, and it's more of a priority for us to monitor how much they're urinating than it is for the risk for infection, right? So some of the reasons why we want to do a strict INO, maybe the patient is on, for example, diuretics. And strict INO is really huge, especially with a patient who struggles with fluid retention or fluid overload. Another reason why we would put a catheter in is because the patient has urinary retention. Okay, so one thing you have to remember about the test and period is that urinary retention is an emergency. Let me say it one more time. Urinary retention is an emergency. It's not something that you should take lightly. So you have to respond immediately if they are retaining urine. Okay, so how do we know that they're retaining urine? Well, for one, we would do a bladder scan. So let's say, for example, for whatever reason, they're not going to the restroom. They're not peeing, right? And so we do a bladder scan, and it's been hours, and they're still not peeing. And we look and evaluate, and we see in the bladder scan that they have urine in there. They have maybe like 400 or 200 cc's of urine, which is not normal. Especially if they should be able to go pee. Now, some reasons why they have lost the ability or the function to use the restroom could be maybe they have a spinal cord injury. They have a spinal cord injury. Maybe they have lost the muscle called the external sphincter. That's something that helps to create that urge for somebody to use the restroom. So maybe they lost that. Another reason why we put a Foley catheter in is because we want to monitor the color of the urine, the consistency of the urine, right? So we want to monitor how the urine looks like. And this is when the patient needs more attention, usually with a urologist. And these patients they usually will have kidney problems. Maybe they have acute kidney failure, but it's a kidney issue. And so when we're seeing this problem happening with these patients, their urine could be cloudy, sedimenty. I mean, it could still be yellow. There are times though where the patient is in serious poor renal function, and I've seen it. Their urine is bloody red. I mean, bloody. Maybe there was a trauma, damage to their kidneys, whatever it is, and it's bloody red, and there's clots in the urine. Like literally, I've seen clots in the urine. So those are the reasons why we would put a Foley catheter in. Now, here's a question. When we insert a Foley catheter, do we use aseptic technique or sterile technique? Well, we're definitely going to use sterile technique, right? So when we're putting the Foley catheter in, so to describe the process of it, if it's a man or a woman, we're going to have them laying flat on the bed, right? And usually we're going to have the legs a little bit raised up. We want it to be a brightly lit room. We want to wash our hands first. We want to educate the patient and tell them what we're going to do. It's going to feel cold. It's going to be uncomfortable, especially if they're a male. You'll have the drainage, the whole kit, okay? So this is just the bag, right? It's just a bag, but you'll have the whole kit. And the way that it works is that you will have the area, okay? You'll have the area that's going to be your sterile technique. Remember, you don't want to break sterility. So it's very important that you're careful with this process. So as you can see, this is the tube part, right? But the way that it would work though is that there would be another port, which would be where we would have the balloon, okay? So the steps that it would look like after we put them in the right position, everything, we have bright light, we put on the mask, we put on the sterile gloves, you know, we tell the patient to relax, all that good stuff. Then we want to check the balloon, okay? There would be a balloon on the tip of the catheter, okay? And then we would push water into the balloon to make sure the balloon works, okay? Make sure the balloon can expand, and then we would withdraw the water back, but we would keep the syringe on there. All right, hopefully you're following along so far. Then we would lube, right? We would also, now that we know that the balloon works, we're gonna go ahead and lube the catheter tip. So we're gonna put a whole bunch of lubricant on there. The important thing to remember too is that you don't want to break sterile technique, right? So you're gonna hold, you know, whether it's the man or the woman, hold the vaginal area, hold the perineal area, and hold it with the same hand. Don't change hands. And then you're going to slowly advance the catheter in, okay? And so we advance it, and literally as you're advancing it, this bag will begin to start to get full with urine. They'll begin to have urine they will begin to show urine in the bag. And one thing you should do when you start to see the urine, you want to advance it a couple of more inches. This is important too. And then you're good to go, right? And then you want to push the water into the syringe. So I would have a syringe, and I would push the water into the syringe to create that balloon, and then I would pull it back just a little bit just to make sure that it's nice and tug in there, okay? And then you would have a clip to clip it to the side of the patient's leg, right? And then you have it hanging down below, okay? So that's the steps of putting in the Foley catheter. You know, it's not hard. You know, it's something that is very common, okay? It's not an uncommon procedure that we would do. Very, very common procedures that we do, right? When it comes to Foley catheters.